Good evening. I'm sorry I can't be in Atlanta with you, but I did want to recognize the great work you do in America's hospitals. The AHA is pleased to count the Association for Healthcare Volunteer Resource Professionals as part of our leadership family. Directors of volunteer services, gift shop managers, hospice administrators, and spiritual coordinators are vital members of the healthcare team. Your organizations contribute 96 million hours to hospitals around the country. That's worth more than $2 billion. Critical funds at a time when dollars are being stretched as never before. Your work provides compassion to the newborn who needs a volunteer cuddler. Your work puts a smile on patients' faces when you visit them with a therapy dog. And your work generates funds for student scholarships and help for patients without insurance. The bottom line is, healthcare volunteers enhance the patient experience and play a healing role for patients, caregivers, and staff. As the transformation of our healthcare system moves forward, we will rely on you as essential partners in helping hospitals advance health in America. You can play a key role in pursuing our vision of a society of healthy communities, where all individuals reach their highest potential for health. Fact is, our field is on the edge of a revolution, not as a result of the Affordable Care Act, but as a result of changes that are taking place in science, information technology, and care management. You know, every generation has been called to redefine what a hospital is, from the advent of antibiotics to the threat of global pandemics. Today's no different, and this is our time. We're going to redefine the H to meet the demands of this moment in a way that secures the place of American hospitals at the center of our communities. Redefining the H means recognizing that right now, we're at an intersection facing multiple options. Some of us will be heavily focused on population health for an attributed population, or taking responsibility to coordinate care so that patients get the right care at the right time in the right place and are not bounced around from one unconnected provider to the next. Some of us will continue to focus exclusively on the very important services that take place in our buildings, whether it is providing trauma care, sophisticated surgery, or diagnostics and therapies that are on the cutting edge of scientific development. Many of us will do all of the above, and all of us will be devoting efforts to inventing new care models as we move from fee-for-service to fee-for-value to accountable care to population health. And all of us will be seeking strategic partners as we work to reshape and improve care and focus on wellness and prevention. As we face these new challenges and seek to turn them into opportunities, the reality of redefining the H is that we are all at different starting points. We are all moving at different speeds, and we are all engaged in massive experimentation. But the simple truth is that the only thing we have to fear is standing still. As we look to the future, hospitals must be Netflix, not Blockbuster. We must be Amazon, not Borders. Hospitals must be Uber, not the taxi cab. And we certainly don't want to be Kodak, because today no sector is so big and so traditional that it can't be disrupted. But we are absolutely determined to ensure that every single hospital, regardless of how you define the H, should have the opportunity to be an access point or anchor of service in the communities they serve. Now, I know it can be frustrating and challenging as we try to address the tough issues. But think of it this way. It's really rare when any generation has the ability to impact their field and profession for the future in the way we do today. We have the opportunity to build a system of care that is more equitable, transparent, and responsive. a system that keeps people healthier. We have the opportunity to improve quality, safety, and the entire patient care experience for our children and their kids as well. We have the opportunity to build a future where hospitals are as much associated with health than sickness, more closely aligned in the minds of our patients with the joy of living rather than the fear of dying. We have the potential to provide continuous care like never before. From the first Facebook photo of a newborn swaddled in a maternity ward blanket to end-of-life care that feels more like being surrounded by old friends. Redefining the H can bring us closer to the communities we inhabit, to the patients we serve, and to our fundamental vision and mission of caring for all who need it. That work starts here, it starts now, and it starts with each of us. I'm honored to be on this journey with you today, as well as in the years to come. Thank you for all you do for our nation's patients, hospital employees, and communities. And thanks for allowing me to be a part of your meeting. Have a great conference.